Hi, my name is Vanessa Medina. I'm a veterinary technician at Southeast Veterinary Neurology. I'm here today with Gracie and I'll be showing you the procedures for post-operative care patients with intervertebral disc disease. Firstly, I'll be showing you how to properly greet your pet. You want to come down to your pet's height, either crouch down or sit on the floor, and this will have the pet not have the urge to jump or get overly excited. Once your pet's in your full possession, you'll have to properly learn how to lift them. You'll place one hand in between their front two limbs and their back hand in between their back two limbs. This will allow their spine to be straight at all times. Now we'll be talking about crate rest. Crate rest is one of the most crucial and critical factors of post-operative care patients with intervertebral disc disease. Crate rest endures 4 to 6 weeks after IVDD surgery. You want to allow your pet to have access to food and water at all times. You also want to walk your pet 3 to 4 times a day. These walks should be short and controlled and about 5 minutes at a time. If you want to learn how to express your pet's bladder, just click the eye above. Following up with bladder expressions, one of the most overlooked critical factors for post-operative care patients with IVDD surgery is urine scalding. If urine is in contact with the skin for long periods of time, it creates an irritation. These irritations can be prevented by keeping the skin clean, dry, using waterless shampoo or waterproof bedding. If the irritations continue, they can be treated with a topical ointment or any sort of oral medications prescribed by a veterinarian. I will now show you how to use the figure 8 sling for your pet. While walking your pet with the figure 8 sling, you want to help lift the hips but not too high, allowing the paws to feel the ground so the pet feels the urge to try to correct their standing position. Next, we'll talk about incision care. Incision care is one of the most crucial and critical factors of post-operative care patients with IVDD surgery. You want to make sure the incision is clean and dry at all times. The incision is something you should be monitoring every day. We want to monitor any discharge, swelling, redness, or irritation. This will allow you to understand if your pet has any sort of infection, pain, or discomfort. Lastly, we'll be talking about home physical therapy. Physical therapy is one of the most important processes for recovery for your patient after IVDD surgery. Physical therapy helps with core stability, improves strength, reduces any swelling or spasms. First, we'll be learning how to flex the legs of each limb in the back, massaging all 4, and also rotating the hips and flexing them as well. You could do this either standing up in this position here, or you can have your pet lay on their side, whichever way is most comfortable. First, you want to start from the toes. So what you'll do is you'll kind of flex the toes up and down. Next, you'll do the hop. So what you'll do here is you kind of want to flex the hock, same position, up and down. And now the hips. So flexing the hips, you'll pull back the leg, extending it. And lastly, you'll do what's called a bicycle movement. So you'll move the whole limb up and down.